to keep these schools safe. It's at the heart of what our government is doing and the actions we are taking. Now, we have in this country, in this province most specifically, one of the lowest rates of cases for youth under 19 in Canada. That is because of our strong infection prevention protocol endorsed by the Chief Medical Officer of Health, funded by our government and Premier to ensure that schools can remain safe and open. As we look to the April break, we obviously are taking a great level of vigilance, ensuring that kids can return to class, because for this government, we believe so strongly that students should be in class today and most especially following the April break. That is mission number one for us. And we're going to continue to stand up for parents and for students who want to be in class against those interests, including our teacher unions, who have continued to urge us to close schools for kids. That is wrong. We can protect our students while taking action in our community. That is precisely what we're doing today. Now, in the context of the April break, we are introducing new protocols to ensure students can return to class safely following that break. That includes an expansion of asymptomatic testing to include testing during the break in all pharmacy and assessment centers for asymptomatic purposes. Before, that didn't exist. You had to be symptomatic to go to an assessment center. We are now providing access province-wide to all assessment centers and pharmacies for both the symptomatic that existed and asymptomatic testing. That is a significant improvement and enhancement to access to testing in your neighborhood. And we are encouraging parents and staff, and of course students that are of age, to get tested ahead of your return. We're also going to be expanding our in-school testing through the Ministry of Education's asymptomatic testing program. We are providing and mandating on-site confirmation for self-screening of students and staff. Before, the screening was done at high school, and for staff, you had an active person asking you questions. Have you been out of the country? Do you live with a sibling that is sick, for example? Do you have any symptoms? Whereas in elementary school, we didn't do that. We're now mandating it for all schools in this province, elementary and high school and staff, to ensure that that active screening is strengthened given the importance of identifying cases before they come to school and not letting them into our school if they have any symptoms at all. We're going to be mandating refresher training for all students and staff on the safety protocols upon their return from their break, making sure that our students are listening and being educated on these important steps they can take to protect themselves, to protect their parents, their grandparents, the people we love within our homes and within our communities. We're also going to be encouraging outdoor education, more outdoor learning where it is possible this spring and summer. We know it has helped us in the fall. We're going to be strongly urging as much education, experiential, outside, in our parks, in our playgrounds, to make this learning process positive but safe. And finally, we're enhancing cleaning, deep cleaning of our schools before kids return over the April break. That is a mandate. And to be fair, many school boards intended to do this. We're going to make sure it gets done right across Ontario. For the week of April 12th to the 18th, pharmacies that offer testing and all assessment centers across the province will accept appointments, as I noted, from students and education staff for asymptomatic testing. That is going to be positive. Now, the government also confirmed the vaccination of education staff will be accelerated, because the Premier, when he said he will do whatever it takes to keep schools safe, to keep them open, this is a clear demonstration of that commitment. Now, we face a challenge of supply in Ontario. I know all provinces do in this country. However, to ensure we focus on those at highest risk, we're ensuring, starting over the April break, using that window of opportunity to really get these vaccines into the arms of staff. All special education staff province-wide will have access to the vaccine starting over the April break. For education workers, all of them, our educators, our bus drivers, everyone involved, our EAs, our principals, everyone involved within our schools that cannot work from home, starting in Toronto and Peel, for all education staff, focused in on those high priority areas for staff that live or that work within those communities will now have access to the vaccine starting April break. Again, focusing and starting in Toronto and Peel based on that supply challenge, but scaling it up to go to other public health units, including in Halton, in York, in Hamilton, in Durham, and in Ottawa, and as supply comes more online over the coming weeks right across this province, because we are determined to ensure every single educator, every single bus driver, EA, EC, everyone who's involved in the delivery of care of our kids in our schools, that they get access to this vaccine. And so over the April break, we will ensure all special education staff in this province can get access to the vaccine next week, and we start in those high-risk neighborhoods, those priority communities in Toronto and Peel, and scaling that up to other hotspots right across Ontario. This is, I think, a clear commitment to ensure that those individuals get access to a vaccine and that they remain safe themselves. And so this plan was fully supported and endorsed by the Chief Medical Officer of Health, and we're going to continue to do what is required to keep these schools safe, as they have been, as every leading medical authority in Ontario and public health officer has said over the past days, and let alone over the past year. There's become clear Ontario's plan has been strong, with a comprehensive protocol on cohorting, on masking, on cleaning, on the expansion of testing, all of which has helped ensure Ontario is leading the way. So we're going to continue to work in partnership with the Ministry of Health to get these vaccines into the arms of many staff as possible. But I think it is promising news. It is, I think, a good positive development when it comes to the work we're doing to keep schools safe. And I want to thank everyone involved for their partnership today.
We'll go to the phone lines for questions. Just a reminder, it's one question and one follow-up. First question.
As a reminder, please press star 1 if you have a question. First question is from Caroline Alfonso at the Globe and Mail. Please go ahead.
Hi, Minister.
Hi there.
You're introducing some new protocols. Why haven't you implemented this sooner? Why now? Why after the April break?
Well, we have continuously stepped up our response to COVID-19 throughout the waves of this pandemic, systematically improving, strengthening, and listening to the medical advice. What we have learned following the Christmas break is there must be a strong program in place to identify and isolate any cases before they enter schools. And that's why, in addition to providing clear advice to parents and guidance to families, to students, as well as our staff, to not congregate, to follow the rules, to ensure we stayed home to the extent humanly possible. But nonetheless, we're going to, I think, learn from history, not take anything for granted. And while we expect everyone to do their part, we are going to ensure that we have stronger protocols in place that are there to reduce any potential case from entering the school. I think that just makes absolute sense given the risks. And I think it's important that the province continues to step up our safety measures as public health advice continues to come to us. So I think it makes a lot of sense that we enhance that protocol, keeping in mind we have the strongest plan in the country. I mean, there's no province that was masking in Ontario in their classrooms. Really, Ontario led the way, going down to grade 4 and then dropping it below that. We're one of the only provinces to offer asymptomatic testing. You know, we have cohorting of students that have successfully worked to limit the spread of COVID-19, where the Chief Medical Officer of Health acknowledged yesterday that transmission has been low within our schools, disproportionately the cases coming from the community. That's not a coincidence, Caroline. That's because we have put in place a plan that has clearly ensured that schools remain safe, recognizing the risk has changed, and therefore so should our plan.
Follow-up.
And yet, students in Ontario have missed more in-class learning than any other region in this country. So what should your government have done differently there?
Well, Ontario has one of the lowest cases of young people under the age of 19 in Canada. It's just, if you remove the Atlantic provinces, it's BC and Ontario in that order. We're doing something right when it comes to keeping COVID positivity down amongst young people, but recognizing, obviously, that when it comes to our schools, the infection prevention measures put in place, as noted by Dr. Lowe, by Dr. Kurji, by Dr. Williams, and many other leading experts, that they have worked. I mean, in the words, if I may, of Dr. Kurji on April 6th, he said, and I quote, "We have not found transmissions in school settings to be of any concern to us, and we think that through our current protocols, where we dismiss cohorts, we're managing the situation quite nicely." So I appreciate, obviously, that there's more work to do. It's why we're stepping up the plan, strengthening it following the April break. It's why we're accelerating vaccine delivery to those most at risk, ensuring province-wide access to special education teachers. And it's why we continue to rely on the best advice from the Chief Medical Officer of Health.
Next question.
from Adrian Gabriel at City TV. Please go ahead.
Hi, good afternoon, Minister. This morning at the EDFO press conference, epidemiologist Dr. Colin Furness called for universal rapid testing in our schools, citing that the number of the voluntary rapid testing thus far since February has been lackluster. Are you looking at universal rapid testing? Similar, he referenced children at school, they get checked, their hair checked for lice. It's just done. Can we just do universal rapid testing in our schools?
So if the opinion of the teacher unions is that we have to mandate testing on children, we will disagree. We think it's important actually to ensure testing is accessible, which is why, in addition to the Ministry of Health and Ontario Health, who's the main delivery agent on testing in Ontario, always has been and will remain so, they're offering testing to in the words 16 to 19,000 kids in the last week alone, under 19, significant access to testing. In addition, in the Ministry of Education, in 2021, responding to the second and now third wave, we have our own system in place where we go into schools, send emails by the principals to staff, to families, encouraging them to come on over a successive period of days for access to either the rapid antigen tests or the PCR test. Sometimes they offer both, sometimes they only offer the PCR. The bottom line is we have stepped up access to testing because we want to make it accessible. To your point, making it universally accessible is our government's priority, which is why for April break, for example, we're ensuring all assessment centers are made available for symptomatic as they were and now asymptomatic testing, which is a significant scale up of access. So we know that there's a place for testing to keep schools safe. It's why we've enhanced access right across the province, and we're going to continue to urge families, particularly for those that may have had some aversion to testing in the past, like, look, folks, this is low, non-invasive or less invasive testing, saliva-based often, or the lower nasal, to where it's not uncomfortable for children. It's in your community, it's in the schools your kids go to, you learn every day. It is free, and most especially it's done in a very professional, clean, and safe setting. And I think it's important for those that are comfortable to go to their local school, go to their assessment center, go to their pharmacy, get a test before your child returns. Let's make sure as a community, as a Team Ontario approach, as our Premier often says, we really look out for each other and our neighbours. If we do that, these kids will return on the 19th with confidence, with a heightened level of vigilance, and I think will allow all of us to breathe easy knowing that our kids are learning where they belong.
Follow-up?
When it comes to the asymptomatic testing in our schools, unfortunately, we've only had about a voluntary turnout of about 1% of the population of students and staff in our schools. Do you feel it's fair and a fair representation of the active cases that we have to continue to share percentages like 99%, 98% of students have not tested positive when we're only actually testing 1% of them? Is that an accurate depiction? Are we playing perhaps politics and spinning the numbers?
Yeah, let me just correct you there. The asymptomatic testing is a voluntary testing program that is set aside through the Ministry of Education, publicly reported. The province of Ontario in this nation has one of the lowest rates of positivity in the nation, full stop. That's not according to the Ministry of Education data. That's according to data available by every Ministry of Education, of Health, that is publicly accessible in this country. With respect to testing, the Ministry of Health has provided access to testing through assessment centers for all symptomatic students and all symptomatic families and staff. That is the data point we rely on. The fact that in this country we have one of the lowest rates of COVID amongst children under the age of 19. That is the data point that is most relevant. When it comes to active cases, that's based on individuals who have gone forth to a assessment center or a location, got tested, it's positive, and then it counts as one of those cases. The fact is, amongst active cases in Ontario, we have, as you noted, 99.86% of staff, of students rather, without a case, and 99.7% of staff without a case, without active cases that we are aware of based on the testing results. But yes, in our asymptomatic testing program that we have unveiled for the past weeks, where we're hitting 5% of schools on a weekly basis, over 200, often 50 schools a week invited, we do have low rates of positivity, demonstrating as the Chief Medical Officer of Health said, those sort of more sample surveys, if you will, localized as they may be, demonstrate that we're not seeing spread. In some of the biggest challenges in Ontario, and some of those postal codes with great difficulty, where we've had communities with very high rates of positivity, it is the school that was disproportionately safer than the community. And Thorncliffe Park was a proof positive of that example. And so we're going to continue to strengthen the safety of schools because they have always been, and we want to ensure they remain safe places for our kids and for staff in Ontario.
Next question.
From Jackie Crandall at CP24. Please go ahead.
Hi, Minister. I'm just wondering about the vaccination of education workers.
Sure.
Is there a promise then from the government that by the end of the break, education workers in Toronto and Peel, or at least in the high-risk areas, will be vaccinated before the return to in-class learning?
So all educators over the age of 55 have access to AstraZeneca today. Educators that may be 60 years old and over have access to Pfizer and Moderna today. What the Premier has announced, I think, which is very positive progress to protecting our staff, is ensuring that over the April break, using that time, given the limited supply available to the Government of Ontario, that we're going to prioritize and commence vaccinations for special education staff province-wide. That's 36,000 educators right across Ontario who work so intimately with these children with, developmental, intellectual disabilities, and we want to make sure that the staff are safe and the kids themselves are safe, given their own vulnerability. In addition, over the April break, starting over that period of time, again, supply and access to the vaccine is the challenge we have. I think that's quite obvious in the province, where we continue to look forward to more supply of vaccines so that we can get them out. But to your question, we're going to start vaccinating in the high priority neighborhoods in Toronto and in Peel, scaling that up across those regions, then to the next hotspots in the province, which include Halton, Hamilton, York, Durham, and Ottawa, and then right across Ontario. Because for every staff member out there, no matter where you are, we want to make sure you're safe. As soon as we get the vaccine, I just had this conversation with the Solicitor General, the Minister of Health, the Premier, all of whom reaffirmed the position they said just prior. As soon as we get more vaccine, we will get it out. We will prioritize those on the front lines in our workplaces, in our central service economy, our educators, our bus drivers, our EAs, our principals, the people who every single day go to work and care for these kids, and we want to protect them. So our commitment is to commence this process over the April break, get as far as humanly possible based on the supply we have, and continue to get them into people's arms as we get these vaccines to the province.
Follow-up?
In terms of getting that to happen, the rollout of that, is that going to be to the province's booking system, or is there going to be, a special way in which you reach out to the education workers who qualify for this to get them to go to a mass vaccination center or otherwise to be immunized?
We're working directly with the medical officers of health, the Chief Medical Officer of Health's office, on the logistics of this. Obviously, in the Ministry of Education, we stand ready and we will be assisting and helping to identify those individuals in the context of what's the identification and the documentation that they may be required to bring. So this is all being worked out in real time, well ahead of April break, to make sure that communication is out there. I'll be speaking to directors and chair of education later today to help explain some of those logistics, but I just want to assure every worker in the province within our schools, driving our buses and helping to protect our kids, you're going to get access to the vaccine, full stop. We're going to start this April break, work very hard around the clock to get it into your arms. The Premier has said whatever it takes, and this is another example of the commitment of this government to just make sure that our students can go to safe in the most maximized environment of safety. They want to go to school, kids want to be in class, and that's why we're announcing these new measures, new supports, and of course acceleration to the vaccine for the people of Ontario.
Next question.
From Holly Mackenzie-Suter at the Canadian Press. Please go ahead.
Hi, Minister.
Hi, Holly.
Just wondering about, to follow up on the questions about required asymptomatic testing. I'm just kind of hoping you can explain more the resistance to mandating this when we know there are other health procedures like some vaccinations that are already required for students to take. So why not kind of make it so that schools do have to do these regular tests, especially in hotspots where we know it would be helpful to kind of have a clearer picture going forward with schools open?
There's no doubt, Holly, that we need to ensure that we have to ensure that testing access is readily available to families, particularly at-risk neighborhoods where the intersection of economics and some of the neighborhoods that face challenges, that they have access to testing, which is precisely the neighborhoods we have identified working with school boards and public health units to get those tests into those schools, trying to use local representatives, principals, individuals that our teachers, and most especially the parents are comfortable with, to encourage participation. I'm not aware of any jurisdiction in this country that has mandated testing on children. At the end of the day, that decision point will be based on the advice of the Chief Medical Officer of Health. He has not in any way given that requirement. What we can do is ensure it is accessible, it is free, it is available to as many families, particularly in the highest risk communities, which is exactly what we're doing on testing and now on vaccines. And I think this will help bridge that gap, protect those at risk communities, and help defeat this pandemic that I know everyone in this province wants us to do.
Follow up?
Yeah, I'm also just wondering about the news that vaccines will start going to people 18 and older in hotspots. I'm just wondering if you can explain why it isn't 16 and older, when that, would definitely have an impact on schools, 16-year-old students and older, and, some of these students that also work essential jobs. So I'm just wondering if that age group is something that you're discussing as well with Cabinet going forward with this hotspot vaccination plan.
We're certainly discussing the importance of gaining access to the vaccine to younger Canadians, particularly to Ontarians that may be below the age of 16, for example, in order to make sure our schools really are as safe as humanly possible. Those discussions are ongoing. Obviously, the prioritization framework announced by the government is very much based on age and on risk. And we're going to continue to follow the best advice of the Chief Medical Officer of Health on that. If anything changes in the context of age and dropping that down, we'll make sure to communicate it, because we want to encourage as many individuals to feel confident in the vaccine that has been extremely efficacious, extremely effective at reducing risk. And I really want to make sure that everyone who wants a vaccine gets a vaccine. I look forward when I am eligible to get that vaccine. I saw the Minister of Seniors get the vaccine, the Minister of Health, the Deputy Premier get the vaccine. I mean, at the end of the day, folks, if we prioritize vaccines, we're really prioritizing the end of this pandemic and what has been a very difficult year, I think, on everyone. So that's something we got to look forward to, and I know everyone will do their part in this province to defeat the pandemic and ultimately put it behind us.
Next question, and this will be the last question.
From Beth McDonald at CTV News. Please go ahead.
Hi, Minister.
Hi there.
Vaccines take some weeks to build up immunity and take effect. Now that we know some teachers in high-risk areas will be able to get the vaccine, that expansion of eligibility, along with the measures you have outlined here this afternoon, do you think that is enough? Are you confident that students will be back in class learning after the April break on Monday, April 19th?
It is our commitment to get schools open in this province following the April break, which is why we have put in place tough additional public health measures to protect our schools, and it's why today the Premier has announced the acceleration of access to the vaccine for some of the highest risk education workers in Toronto, Peel, and really right across Ontario when we're looking at the special education staff, getting them priority. This is a plan to keep schools safe. This is a plan to keep kids in class where they belong. And yes, we are confident because the best advice by the Chief Medical Officer, by some of the leading infection prevention leaders in Ontario have said, kids need to be in class. It is the safest place for them. It is critical to their mental health. And we're going to stand up to make sure kids can return to class on the 19th. We think it is essential for their learning, their development, and their own health. And we're very much on the side of parents that want to see that happen.
Follow up?
Okay, so basically you believe this is enough to get Peel and Toronto back in school, these combined announcements, that we'll see that?
We absolutely have confidence that the plan in place, balancing additional vaccines to the most high-risk education staff, as well as enhanced infection prevention measures, are going to reduce risk, improve the safety of schools, get these kids back in class where they belong, and we will stand ready to do anything more as advised by the Chief Medical Officer of Health, as we have done since September, continuously stepping up, improving, investing, enhancing those measures to keep kids safe. Thank you very much.